Thank you, Roberta and Robin, for asking me to be here today to share this story. You know, it should be so simple, black and white, right? You get pregnant, you're going to have your baby, it's going to be healthy, but that's not what happened in my family. In December of 2007, my son and daughter-in-law came over to my home to celebrate my birthday. They were bringing me all kinds of gifts and everything, but in this one little envelope, there was this black and white picture, and they pulled it out, and I looked at it, and I had no idea what it was, because I thought, you know, they hadn't talked anything about babies or anything, but they had talked about getting a new dog, and I said, oh, you'd have a puppy. You know, I wasn't looking that closely. Well, it turned out that they were showing me an ultrasound of what was to be my very first grandchild and their first child. We were so excited. We waited for so long for this. Several weeks later, they went to the doctor for just a normal checkup, and they hooked up the Doppler to listen to the heartbeat, and they didn't hear anything. And so the doctor said, let's just get an ultrasound. And when they did the ultrasound, they saw the fetus, but there was no beating heart. The pregnancy was no longer viable. The doctor tried to console them by telling them, this is nature's way. Sometimes there's something wrong with the babies, and they just don't survive the pregnancy. But you're young, you're healthy, and you should try again. And so as hard as that was to accept, they tried again and had the same results. As fate would have it, my daughter-in-law, who was a TV producer, was working on a show called Deliver Me. She was working with 3 high-risk obstetricians that were following women through pregnancy, through delivery, and they were on the Discovery Health channel. And she explained her situation to them, and the first question they asked is, did the doctor do any blood work on you? Has anybody examined you that way or told you anything that maybe there is something wrong? Nothing had ever been told to her other than she was healthy, normal, and it was just probably something wrong with the baby. So they began to run tests on her, and she tested positive for this antiphospholipid syndrome, APS. It is a disorder that causes clotting during pregnancy. The immune system produces antibodies to certain proteins found in the blood. And having this may lead to the formation of clots and low body weight for babies, and can cause complications of pregnancy. When she became pregnant for the 3rd time, my daughter-in-law returned to these 3 doctors for her care. And actually, she was on the show and did deliver her baby. Since they were now aware of her condition, they were able to prescribe blood thinners that she injected daily, the blood thinner Luvenox. She delivered a beautiful, healthy baby girl in April of 2009. Today, this child is bright and happy. She is a true joy to all who know her. If it weren't for the doctors that were aware of this blood clotting disorder, this child may never have been born. I am thankful every day for the knowledge of these 3 beautiful doctors and my very brave daughter-in-law for going through this very high-risk pregnancy. And here's a picture of my daughter-in-law Robin and my granddaughter Alexandra. Biggest joy in my life. Thank you for letting me share.
Thank you, Sharon. Since Shane passed away, many of you have asked, what can I do? How can I help? And so many of you have already helped in many ways. But this is a way you can help all women and their babies have a good chance at health free of life-threatening blood clots. We'd like to ask each of you to be our partner in sharing information on a grassroots level, woman to woman. We have created this brochure presenting facts, risks, and symptoms in simple, non-technical, easy-to-discuss terms. Our goal is to have this brochure available in OBGYN waiting rooms so that women will understand the issues and know how to frame the questions to discuss with their doctors. Here's where you come in. On your way out, you'll receive a gift bag. In that bag, you'll have brochures, a Lucite brochure holder, and a letter you can give to your gynecologist or OB, asking him or her to place the brochures in the waiting room. It's as simple as that. You don't need to remember any specifics. It's all in the letter. This step will start a conversation, spark some questions, and hopefully save lives. But LA is just a start. If you have friends in other cities who'd like the kit, please let me know. I'd be delighted to mail the brochures to them. Together, we can work for a world free of treatable blood clots in women and their babies. I'd like to thank you in advance for your partnership in this effort. The Shane Foundation is committed to fighting this women's issue that has gone under the radar for far too long. Correct diagnosis and treatment should not just be for the lucky few women who are fortunate enough to be treated in elite clinics or happen upon it, by working on a TV show and coming up against one of these doctors. Your partnership in the brochure initiative, along with your generous donations, will support critical medical research to create better testing and genetic information. Your donations support education programs among patients and professionals. Your donations fund projects like this to put vital information into the hands of women everywhere. It's not a coincidence that we chose this date for our event. May 9th would have been Shane's 5th wedding anniversary. This Sunday is Mother's Day. Shane wanted to be a mother and wanted to enjoy anniversaries. She never got either. For those of us in this room who knew Shane and loved her, this will always be very personal, but we realize that the work of this foundation is no longer just about Shane and our personal loss. Please help us through your donations. Laura, Abby, and Alexis are in the back waiting to help you as you exit, or visit us online at shanefoundation.org. Your partnership in this project to make sure other women benefit from our knowledge and our strength is so meaningful and so much appreciated. Thank you so much for coming.